Hi, I'm Dr. Michael Taggart with the Kirkland Thyroid Institute, where we specialize in the comprehensive evaluation and successful treatment of chronic thyroid conditions. Today, we're going to be talking about the brain. The brain is very important for thyroid health. Reason being is that there are two glands in the brain that drive the thyroid gland, the hypothalamus and also the pituitary. So if we have a functional brain imbalance where the different lobes of the brain are not communicating properly, the signals aren't moving through the brain as they should, it can affect those glands and in turn affect your thyroid gland. So every patient that we see gets a neurological evaluation to determine if there's anything in the brain that needs stimulation to help get those neurons working better, to help stimulate the glands and ultimately help your thyroid gland. Now, in order to have a healthy brain, we have to have two things. We have to have what we call activation, and then we also have to have fuel. So activation is going to occur by things that you do to stimulate brain function, like exercise is very important stimulating effect on the brain. Also, things that stimulate your senses, like your sight, hearing, these things stimulate your senses. Other things that you do, like thinking, the things that you do at your job, mathematics, creative things, those all stimulate brain function. Now what we find is that sometimes patients need extra stimulation or activation to get those different parts of the brain working properly. As we do that, that's going to ultimately help the thyroid. Now also, the brain to function properly needs fuel. It needs a good, steady fuel supply. The fuel supply for the brain is oxygen and also glucose. So let's talk about oxygen for a minute. Oxygen is what you breathe in your lungs. Now interesting, as you get older, you actually lose the ability to process oxygen as efficiently as when you were younger. At age 25, you lose 1% of that capacity, which is called oxidative phosphorylation, every year. So if you're 50, you've already lost 25% of the capacity that you have to metabolize oxygen properly, get into your thyroid gland and get into the cells. So that's why in our office we use something called exercise with oxygen. We have oxygen concentrators in our office and we have people actually exercise while they're breathing oxygen. That helps to get more oxygen to the cells. It helps our patients get off to a very fast start on their thyroid recovery programs. Now, the other concept is fuel, and that's going to come from the food that you eat. The food that you eat eventually is converted into glucose. The glucose is going to get in the cell. It's going to create energy, and it's going to keep the cell metabolizing and doing what it's supposed to do. Now, blood sugar problems are definitely chronic in our society, so it's very important that whether you are hypoglycemic or functional, have high blood sugar or have what we call insulin resistance, that issue is handled. Because it's not only important for thyroid, it's important for every system of your body, and it's important for your brain. So, also what's interesting is that your blood sugar affects your neurotransmitter function. Neurotransmitters are different chemical messengers that go between neuron and neuron in the brain. And what happens is that if there's blood sugar issues, you can develop low serotonin. And low serotonin will actually something that will actually inhibit your body's ability to drive your pituitary, which will cause your thyroid gland to become sluggish. You end up with low thyroid symptoms because of the serotonin deficiency. Now that is typically handled in most cases without supplementation, just getting your blood sugar working again, and that condition is usually handled itself. So blood sugar is so important that we actually talked about it on our number 4 secret to helping you overcome your chronic thyroid condition. So if you want to see a doctor who understands the entire physiology of the thyroid and understands all the different things that can go wrong with it, and knows how to do the right tests and what tests need to be done, and is actually getting success with patients, and the protocol that he's using is actually working all over the country and patients are getting well, then you need to call my office and get scheduled for your free 2 visit. So give us a call at 425-821-1101.